endotracheal intubation. It is a process in which we are going to fix endotracheal tube inside patient trachea to make him breathe passively. In this video, I will take you a step-by-step process of endotracheal intubation. There can be several reasons of intubating a patient. Some of them are if the patient has Glasgow coma scale of less than 8, during cardiac arrest or respiratory arrest, in case of facial trauma and facial burns in which we have to secure patient airways, and before surgery. There are several contraindications of intubation. For example, severe skull and facial trauma, laryngeal trauma, and severe cervical spinal trauma.
Before we start the procedure, we will make sure that we have all the necessary equipments and they are functioning properly. An appropriate size mask for oxygenation, self-reinflating resuscitation bag, endotracheal tube, and laryngoscope. There are three main parts of endotracheal tube. The first one is adapter. It connects the endotracheal tube to respiratory devices. The second one is pilot balloon. We will insert air through it. And the third one is high volume low pressure cuff. When this cuff will be filled with air, it will get fixed into the trachea and it also prevents aspiration. Now we are going to start the procedure. First step is to position the patient. Patient head should be in sniffing position, which means that patient lower cervical spine should be in flexion and upper cervical spine should be in extension. The second step is pre-oxygenation. In this step, we will provide 100% oxygen to the patient for 3 to 5 minutes in order to maximize oxygen reserve in patient body. The third step is laryngoscopy. In this step, I will hold laryngoscope in my left hand with the blade facing to the patient's mouth. I will insert the blade to the right side of mouth, displacing the tongue from right to left. Then I will move my hand slightly forward. I will be able to see epiglottis. There is a space between tongue and epiglottis known as valvula. When you will put upward and forward pressure on valvula, the epiglottis will move upward and you will be able to see vocal cords of trachea. This is the exact place where you have to insert endotracheal tube. Step number 4 is intubation. Take endotracheal tube in your right hand and insert it through the vocal cords. Step number 5 is inflation and auscultation. I will inflate the cuff with the recommended volume of air and I will verify the tube placement of endotracheal tube by 5-point auscultation. 1 at epigastrium, 2 at apex of lungs and 2 at base of lungs.